Hi guys, in this video we're going to talk about the anatomy of extrahepatic biliary system. So to talk about what happens to the bile as it comes out of the liver, like we said that in the previous video, the bile gets produced by the liver and then it comes out from the liver by the bile canaliculi, and then they would join together to form the ductules and then the right and left hepatic ducts and then the common hepatic duct. And then we're going to have a journey with the bile as it goes all the way to open into the second part of duodenum. But before getting into the journey of the bile, let's take a closer look of two important organs that are parts of the extrahepatic biliary system. They are parts of the biliary system, but they are extrahepatic because they will participate in that process, but they lie outside the liver. So that's why we consider them as such. So these are the gallbladder and pancreas. Let's take a look at them, understand some important relations, and then continue the journey of the bile as it comes out from the liver and see what happens to the bile. So the first organ is the gallbladder. So the gallbladder is a very important organ. It concentrates and stores the bile that is produced by the liver. The gallbladder lies in the right hypochondriac region. So as you guys can see from this picture, it lies in the right hypochondriac region. And then if you try to look at the gallbladder, where exactly it sits in the fossa for gallbladder. Now, if we want to know the surface anatomy of the gallbladder, which is very important because that is important during the physical examination, you guys need to know that the gallbladder lies at a point of intersection between the ninth costal cartilage and the mid-clavicular line. So if I have a mid-clavicular line with a line of the ninth costal cartilage, I'm going to find the place where I'm expected to see the gallbladder, so I can go ahead and make my differential diagnosis to make sure if the patient is complaining from a pain of gallbladder, because gallbladder is going to have referred pain to different places, and we're going to talk about them in a bit, but this is an important thing to do during clinic. So remember that this is the surface anatomy of the gallbladder. Now, if you look at this picture here, you guys can see that the gallbladder lies in the visceral surface of the liver, and it's related to the first part of duodenum, which is a very important relation, and the fundus is basically related to the transverse colon. And so anteriorly you would see the inferior surface or visceral surface of the liver. Posteriorly you have your first part of duodenum, and that is very important, and we're going to talk about this relation in the small intestine, in the duodenum, because it's really important in terms of cholecystitis, or there is an important relation that's going to be explained in that video. All right, so these are the things around the gallbladder. So moving on, it's important to know the referred pain of the gallbladder. So if a patient has cholecystitis pain, I would expect to see that pain radiating to below the right scapula, all right, around the epigastric region and in the right shoulder. And the reason why is because the gallbladder gets sympathetic innervation from the greater splanchnic nerve, T7 to T9. It gets parasympathetic innervation from the anterior vagus, and it also receives innervation somatic from the right phrenic. And because the right phrenic comes out from C3, 4, 5, and these roots, they give the supraclavicular nerves, and these nerves supply the right shoulder here. That's why if I have irritation to the nerve, and that nerve is basically going all the way to the spinal cord segment, all right, C3, 4, 5, so it comes from the sensory root, gets in here, and I already have innervation from the somatic nerves of supraclavicular nerve. I'm going to feel the same kind of pain, which is actually coming from the gallbladder. I'm going to feel it in my right shoulder. Now, why do I feel the sympathetic pain and parasympathetic in those regions, in the epigastric and below the right scapula. Below the right scapula, because this is the same as the dermatomes of my somatic nerves, T7 and T9. It's basically here. That's why when the pain comes from the sympathetic nerves, it comes all the way to these spinal cord segments. These segments are also receiving somatic innervation from T7 to T9 of that region. Here is basically T7 and T9. So that's why I get here kind of pain, and also in the epigastric region. And for more details about the innervation of the sympathetic and parasympathetic, and why do we feel pain of the gallbladder there, and everything about abdominal viscera pain, that's going to be in a separate video. Please make sure to listen to that video. Now, moving on, the other organ we have is basically the pancreas. So pancreas is the other organ that's related to the extrahepatic biliary system. And the pancreas lies in the epigastric and left hypochondriac region. So to make your life easy, remember that your liver is the big boss. So the liver is situated or is located in right hypochondriac region, epigastric and left. Now, for the pancreas, which is a bigger organ, which is a bigger of the other two organs, it's the middle-sized organ. So it will be located in the epigastric and left hypochondriac, and the gallbladder is in the right hypochondriac. So that way, the liver is covering the whole area, gallbladder is only here, and pancreas is in these two. So we are playing in the same three quadrants, all right? Sorry, not quadrants, regions. All right, so right hypochondriac, epigastric, and left hypochondriac for the liver, right only for the gallbladder, epigastric, and left hypochondriac for pancreas. Now, the pancreas is considered to be a retroperitoneal organ. Why? Because it lies behind the peritoneum. Why? For more information, you guys need to listen to the peritoneum video. To understand more about the retroperitoneal, intraperitoneal, and subperitoneal structures. So the whole pancreas is considered as retroperitoneal except the tail, because it lies in the splenorenal ligament, and that's why it's considered as intraperitoneal. So moving on, pancreas has parts, and these parts are the head, all right, the neck, the body, and tail, all right? And then there is an uncinate process, which is basically an extension of the head. This is a downward extension. What's very, very unique about the uncinate process is that the superior mesenteric vessels lie anterior to it, all right? So the uncinate process of the pancreas shows the superior mesenteric vessels in front of it. So if you guys look at this picture, seeing that superior mesenteric artery and superior mesenteric vein, your uncinate process is basically behind that. This is one thing about the uncinate process. Another important thing about the neck of pancreas, actually neck is not written here, which is very important, is that you guys, if you look at the neck of pancreas, what happens posterior to the neck, which is basically at that region, is that the union of the superior mesenteric vein and the splenic vein to form the portal vein. So remember that behind the neck of pancreas is the formation of the portal vein, all right, and the portal vein is formed by union of splenic vein and superior mesenteric vein. All right, so uncinate process shows the SM vessels, SMA and SMV, superior mesenteric artery and vein. However, the neck of pancreas posteriorly shows the formation of the portal vein, which is formed by union of superior mesenteric vein and the splenic vein. All right. Other than that, the head is very important structure, part of the pancreas. The head of pancreas lies in the C-shaped duodenum, and that makes sense because in the C-shaped duodenum, where I have the head of pancreas, I'm going to receive my pancreatic duct, and that eventually is going to open into the second part of duodenum with the union of common hepatic duct and the pancreatic duct. Together, they will open into the second part of duodenum. So the head of pancreas lies within the C-shaped duodenum. All right, and another important thing you guys need to know is that behind the head of pancreas is the inferior vena cava. So inferior vena cava is very important vessel that lies behind the head. So behind the head is the inferior vena cava. All right, behind the neck is the portal vein. All right, and then the common bile duct, guys, the common bile duct, this is the common bile duct as it unites with the pancreatic duct to open into the second part of duodenum. It has an important relation to the head of pancreas. I'm going to show you that in a while, but you guys need to know that the common bile duct is the common CBD, the common bile duct is also related to the pancreas, and that's important in case of a tumor head of pancreas, because I'm going to get specific signs and symptoms, and you guys need to know them, right? So the head of pancreas lies in the C-shaped duodenum. The superior mesenteric vessels, they come from the backside of pancreas, and then they show up in front of the uncinate process. Behind the neck of pancreas is the superior, the union of superior mesenteric vein and splenic vein to form the portal vein, and behind the head of pancreas is the inferior vena cava, and the common bile duct has multiple relations uh, um, with the pancreas and with the duodenum, and we're going to talk about that in a while. All right, and that is a picture showing the union of common hepatic duct with the cystic duct to form the common bile duct, and then the common bile duct unites with the pancreatic duct within the wall of second part of duodenum to form uh, the uh, the ampulla of Vater. All right, we're going to talk about that in more details in the duodenum. So if you guys look at this picture, you can see that this is the inferior vena cava. So it goes down all the way posterior to the head of pancreas. So if that was my pancreas, all right, and that is the head of pancreas, and this is my C-shaped duodenum, all right, so posterior to the head of pancreas is the inferior vena cava. Remember that. All right, so and this is another picture. So moving on, we guys can look at this diagram that will help us to understand something important about the pancreas, which is if you guys look at the common bile duct, so you guys know that the story of the bile starts at the liver, where we produce the bile, and then we take them by bile canaliculi, and then they unite together to form ductules, and then the ducts. So ultimately, out of the liver, we get right and left hepatic ducts, and they will unite with the cystic duct, all right, to form the common bile duct. And then the common bile duct, it has a supraduodenal part, and then retroduodenal part, and then infraduodenal part, and then intraduodenal part. This is the way that the bile duct can reach the second part of duodenum to unite with the pancreatic duct, all right, to form the hepatopancreatic ampulla or ampulla of Vater, all right, within the wall of duodenum. And we're going to talk about this concept in the duodenum anatomy of small intestine. Now, what's important here is if you guys try to imagine that your head of pancreas is basically here. So if you get an exam question, let's say, and they ask you which part of common bile duct is affected in tumor of head of pancreas, you guys need to know that it's the infraduodenal part, because if you look at this picture, it will make sense that this is the part that gets compressed if there is a tumor of head of pancreas. All right, and that's why if there is a patient manifesting a problem, which is obstructive jaundice, okay, because this is the final output of the bile So if I have a compression on the bile, um, and at that point, it means that I cannot take the bile out of the whole system. It goes back and then it gets absorbed in the blood. And then I get a patient with obstructive jaundice with yellowish of, you guys know the manifestation of that. So you need to think about a tumor of head of pancreas. All right. So this is one of the very important relations of the pancreas. So what would a tumor of head of pancreas show? Remember we talked about the CBD, all right? So we talked about the CBD, which is gets compressed, all right? It gets compressed if there is a compression on the infraduodenal part of the pancreas. And then we talked about the how the inferior vena cava lies posterior to the head of pancreas. And if that happens, that will end up having edema on lower limbs. So this is another signs and symptoms you guys can see in the clinic, and you need to think about tumor head of pancreas. And then the third thing is your portal vein. Remember, you guys, that the portal vein, formation of portal vein happens behind the neck of pancreas by union of superior mesenteric vein and the splenic vein. So if a patient has tumor head of pancreas, that would compress the portal vein, and that shows portal hypertension. And all the details about the portal hypertension and how and what can it do, you guys can find it in the video of esophagus. All right. And of course there are other problems of that which is not in that video, but I talked about the portal hypertension in more details in that video. All right, so remember the relations of the important relations about the head of pancreas. All right, because these are area of exam questions. Now again, let's get back to what happens as we form the bile in the liver. So we take them by bile canaliculi and then ductules, and then to the right and left hepatic ducts, and then together they will form the common bile duct. I'm sorry, hepatic duct, and then the common hepatic duct unites with the cystic duct to come all the way to form the common bile duct, and then it unites with the pancreatic duct to open within the wall of second part of duodenum, and they form what we call a hepatopancreatic ampulla. So the hepatopancreatic ampulla is basically widening within the wall of duodenum, and because that widening happens because of union of a duct that comes from the liver, because everything happens by the liver. So that's why we give it importance and we give the name based on that. So we call it a hepatopancreatic ampulla. All right, so this is the widening that happens in the second part of duodenum. And thanks to the sphincter of Oddi that has three parts actually, and because this sphincter is actually closed, all right, so when the liver is forming the bile, which is around 500 ml up to 1000 ml per day, so my body cannot store that much of bile. So what happens is it comes down all the way, it comes all the way down, and because the sphincter of Oddi is basically closed, it goes back, all right, and gets stored in the gallbladder. It gets concentrated from that much of bile until it reaches 50 ml, and it gets stored there. And whenever I need that bile, I will get once the stomach feels that it wants to send fat to the duodenum, the enteroendocrine cells will secrete the cholecystokinin, and cholecystokinin is going to release the sphincter of Oddi. It's going to open the sphincter of Oddi, and in that case, the bile is going to come all the way to the duodenum. All right, and it opens this, and both of them with the pancreatic juices, they would reach the second part of duodenum, and we're gonna continue the digestion of food. All right, so this is the story of the bile as it reaches the second part of duodenum. Now, what about the blood supply? So you guys know the major idea of the blood supply of abdomen, which we talked about it in the stomach. And when I say it again now, It's basically when we talk about the blood supply of the abdomen, we need to remember that we have three sources of blood supply to the abdomen from the abdominal aorta, which is basically the celiac artery, the superior mesenteric artery, and inferior mesenteric artery. These are unpaired branches coming out of abdominal aorta from the anterior aspect of it. The celiac artery is the artery of foregut, derivatives of foregut. You guys, if you don't know them, please make sure you know them. And then the superior mesenteric is the artery of derivatives of midgut, and then the inferior mesenteric is an artery of the derivatives of hindgut. Now, because the gallbladder is an organ of foregut, so we are expecting that to see that the blood vessels that supply the gallbladder is coming from the celiac artery. So again, for a recap, celiac artery gives us three branches. It gives the left gastric, and then it gives the tortuous splenic that reaches the spleen. All right, and it gives the common hepatic. Why do we call it common hepatic? Because it gives the proper hepatic that's going to go to the liver, and it's going to give something that goes down, which is the gastroduodenal. So if you look at the celiac trunk, all right, so you have the splenic, you have the left gastric, and then you have the common hepatic. The common hepatic is going to give you the proper hepatic that's going to go to the liver, and then the gastroduodenal that goes down to supply the structures down. Now, from the proper hepatic, I'm going to get right and left hepatic arteries, all right? And because the gallbladder lies in the right loop of liver, so the cystic artery arises from the right hepatic. In what? In a triangle called the cystohepatic triangle. If you guys look at this triangle, all right, if you guys look at this triangle, you will find that you have the cystic duct, the common hepatic duct, and the inferior surface of liver. And because the hepatic, the proper hepatic artery was coming from here, it gives right hepatic and it gives left hepatic. So the right hepatic gives the cystic inside that triangle. So we call it cystohepatic triangle. Why is it important? Because as a surgeon, if I want to do a surgery to the gallbladder, I would expect to find the cystic artery in that triangle, and I would ligate it before doing the surgery. So this is a triangle that I would expect to find the cystic artery that supplies the gallbladder. Now, moving on to the blood supply of the pancreas. You guys remember that pancreas is an organ of foregut. All right, so the upper part of the head of pancreas is following the upper part of duodenum, and because in that point which is basically the opening of the hepatic, the common bile duct with the pancreatic duct, here is the demarcation between the foregut and midgut. So above that line, I have arterial supply from the celiac, and below that line, I have arterial supply from the superior mesenteric. And what's going to happen to the duodenum, the upper part of it, the first and second part up until this point, is going to be the same for the upper half of the head of pancreas. And what happens below that is going to be the same. So above that line, we have arterial supply from celiac. Below that line, we have arterial supply from the superior mesenteric. So what is the arterial supply? So from the celiac trunk back, again, we have the left gastric, we have the superior mesenteric, and common hepatic. So the common hepatic gives something up and something down. The up is the proper hepatic, and the down is the gastroduodenal. Why do we call it gastroduodenal? Because it gives gastric branch and duodenal branch. The gastric one, we talked about it in the stomach, and the duodenal is basically the superior pancreatico-duodenal. All right, superior pancreatico-duodenal is going to give anterior branch and posterior branch. The same story happens to an artery comes from the superior mesenteric. From superior mesenteric, we're gonna get inferior pancreatico-duodenum. So the inferior is going to give me anterior and posterior branches. So the inferior pancreatico-duodenal is coming from the superior mesenteric artery, and that was coming from a branch that comes from the celiac artery. All right, so they will give anterior and posterior branches. If you guys look at this is from a branch from the celiac. So that was coming from the celiac. So the superior pancreatic duodenum gives anterior and posterior branches, and the inferior pancreatic duodenum coming from the superior mesenteric. So they will anastomose together. All right, so up until this point, above that is from the celiac, and below that is from the superior mesenteric. And surgically, they consider the head of pancreas and the duodenum as one unit because they share the same blood supply. All right, with that, we reach the end of this video. Don't forget to like and subscribe and watch the other videos of the module.